That was quite a messy situation. Anyway, back to more serious matters, and preliminary findings from 2 South African clinical trials suggested the omicron variant of the coronavirus has a much higher rate of asymptomatic carriage than earlier variants, which could explain why it has spread so rapidly across the globe. The studies, one of which was carried out when Omicron infections were surging in South Africa last month, and the other, which resampled participants around the same time, found a far greater number of people tested positive for the coronavirus but were not showing symptoms compared to previous trials. Dr. Nigel Garrett is the head of vaccine and HIV pathogenesis research at the Center for AIDS Program of Research in South Africa. Good morning to you, Dr. Garrett, and thanks so much for your time.
Good morning, Tabitha, and hello to all your viewers, and a happy COVID-free year to everyone.
Oh, yes, from your lips to God's ears, may it be a COVID-free year. Now, it seems almost that it stands to reason, almost, you could say that it follows that given the fact that we've also heard that Omicron seems to be exhibit less serious symptoms, that people don't suffer severe illness when they contract it, then perhaps it also makes sense that you would have more people that are actually positive or are carrying the virus who are not exhibiting any symptoms as well.
Yeah, that's right, Tabitha. So the study, maybe just very briefly, some of the viewers probably know about the Sisonke study where we provided healthcare workers with the Johnson & Johnson trial. Mm-hmm. And we ran a slightly smaller study at the research sites where we followed them up. And there's a second study, the Ubuntu trial, where we're looking at the Moderna vaccine now in South Africa and other African countries. And what we found is that in the Ubuntu study that was started in December when Omicron came around, about 30% of our participants that received the vaccine then tested positive for COVID. Mm. So on the day when we give the vaccine, we always check for symptoms, and we usually delay vaccination. So we found that out of the first 260 participants, 71, so almost a third, had COVID at the time. So what we did is we then compared that to all our previous trials, and we found that we only saw about 1%, maybe maximum 2% of people having COVID at the vaccination visit. Mm. So we also checked whether that was different for people who had previous COVID or not, and it didn't seem to make any difference. Mm. So we thought these are preliminary results, but it's important to get that out to the other researchers and so on to also look at this a bit more in detail.
And in terms of the study, the people that you carried it out on, what's the profile there in terms of age and so on? And I wonder whether that would make a difference one way or the other.
Yeah, so the Sisonke study is all healthcare workers. Mm-hmm. But the other study, the Ubuntu study, is conducted among people living with HIV, but also people not having HIV. But interestingly, we thought perhaps this has something to do with immunosuppression, so not having quite a strong immune system, but it actually the rates in people with HIV or without HIV were almost the same. Mm. So what we suspect is that, as you said earlier, that we're seeing slightly less severe disease. Omicron can still cause severe disease, but somewhat less in Delta and Beta. But that we also see more asymptomatic disease stages, so it is possible that some of them still develop symptoms later. But essentially that makes it a little bit complicated in terms of transmission because we don't really know anymore who may have COVID and who doesn't, and we can't self-identify ourselves sometimes. So in terms of transmission, that may have some implications.
And what has been your experience with people living with HIV and AIDS? And, because I remember there was huge concern that if indeed people with comorbidities are more susceptible to this and most vulnerable to this coronavirus, then that the immune compromised people would be even worse off.
And that's what the researchers found, that severe disease is almost 2 to 3 times more likely among people who are severely immunocompromised. So those populations are particularly vulnerable and definitely need vaccination and support. So this is why we started also the Ubuntu study to study that a little bit more. We know that people who are on treatment, HIV treatment, do much better. They have better immune responses against COVID, but also to vaccination. So they are definitely more protected. So we need to ensure that everyone still gets access to HIV services during a COVID pandemic.
It seems to me this is a little bit worrying, though, when you're starting to find that you'll find maybe variants that will be where there will be more people who are asymptomatic or asymptomatic carriers, because especially if we get to a point where we get a variant that maybe exhibits a similar property to Omicron, but which does lead to severe illness like Delta does. Because if you can't pick up, if you find that there's a lot of people that are, walking around not showing any symptoms but actually have the virus, that could be seriously problematic.
Yeah, so this is the big question now everyone's asking. But I think in general in history, if you look at other viruses, generally speaking, virus become what we call less pathogenic over time because it is not in their interest to make people sick and they're what we call the host to die. So they want us to survive and eventually live in symbiosis, so live in harmony together so that they survive as long as possible. So what you see sometimes towards the end of pandemics is that you get these hypermutated viruses that that may not be as pathogenic. And it's really a response by the virus to the increased immunity among the population. We know in South Africa up to 60 or even 80% of people now have COVID. So there is a considerable amount of what we call natural immunity and obviously topped up with a relatively good vaccination coverage that can still be improved. That is already putting a lot of pressure on the virus.
And I see that in terms of the Omicron variant, the latest coming out of Europe is that more than 50% of the population, I think, is it 50% or am I even being underestimating it or being conservative in my numbers, but that are likely to, will get contract Omicron. Do we think that the same trend is likely to follow here as well? Because it seems that this Omicron has been behaving very differently across the world.
Yeah, so as you know, that Omicron was first discovered in, Botswana and South Africa. So we have actually already gone through the peak of this wave, and we have already experienced this. And many people have been affected by this over Christmas, for example, that family members got COVID. I think my suspicion is that we have actually tested it a lot less this time around because of perhaps some milder symptoms. So we're kind of underestimating almost the case number a little bit. But what's happening in Europe and the US, obviously the concern is that the baseline seroprevalence, so the previous infection rates are much lower there, although maybe the vaccination rates are slightly higher. But, they have slightly older population, more vulnerable population. So I think the key, basically, message is still to carry on with preventative measures, carry on wearing masks for now to get through this pandemic, and then perhaps protect vulnerable populations in care homes and hospitals by providing rapid testing more, so we identify people with COVID. And then obviously keep vaccinating. I think we still have 60% of our population who have not been vaccinated yet.
Yeah. All right. Dr. Nigel Garrett, thanks so much for joining us this morning. Appreciate it.
Thank you.
Dr. Nigel Garrett is the head of vaccine and HIV pathogenesis research at the Center for the AIDS Program for Research in South Africa.
Power traffic.
Thanks,